Thank you. Thank you very much. I will start my presentation, and as I said before, this presentation was prepared for Danish embassy and was also presented in an international meeting. But I will be happy to share with you, the slides are like pork, nothing goes wasted. And, and this is an important lesson. So this is the title, but basically we start with the lesson from COVID. We had very bad lesson. We learned at the cost of some lives, and lives for doctor and patient. The first lesson is not always going physically to the doctor is the smartest solution. You have to avoid to go to the doctor. This seems to be the lesson. But the second lesson is a consequence. If you avoid going to the doctor, your life is in danger. Because we had, for example, in Italy, a reduction of heart attack death. Well, I can believe that we have a real reduction of heart attack. We have only a reduction of diagnosis of this kind of death. The third lesson is that Italian national healthcare system, but not only the Italian, is not a resident system. We have only an amount of resources that are just the exact number needed, or sometimes a little bit less. Overloaded hospital and overloaded health system were one of the contributing causes of very high mortality rate in Italy, but generally for COVID. The fourth lesson is on digital. Digital medicine is not so bad. We had from quote expert, a lot of bad thinking about old people and digital. We are not ready. The patient are not. They are not happy with digital. Wasn't so bad. The digital was the only solution, but sometimes was a best solution. There was an improvement, good productivity, satisfaction of workers. But the lesson is also without data you can manage, forecast, model. In Italy, we had red zones, orange, yellow, and we heard too many parameters. I work with the government. You said 21. We would like to have only 5. And I said, we hope to have 100, not only 21. We need a lot of data. And this is a lesson. But we have a lesson from the past. This is Niccolò Machiavelli. Change management is a risky business. In Google, you can have the first print of this book, 1540, and let it be noted that there is no more delicate matter to take in hand, no more dangerous to conduct, nor more doubtful in its success than to set up as a leader in the introduction of changes. Our job. For he who innovates will have for his enemies all those who are well off under the existing order of things, and only lukewarm supporters in those who might be better off under the new. Obviously, because the adversaries have the laws on their side and the incredulity of mankind who never admit the merit of anything new. We are discussing about new models, all of us, until they have seen it proved by the event. And COVID gives us a good lesson. The result is that whenever the enemies of change make an attack, they do so with all the zeal of partisan, while the other defend themselves so feebly as to endanger both themselves and their cause. But Machiavelli knows quite well that the problem without a solution is nothing. So the solution is we must look whether these innovators can stand alone or whether they depend from aid upon others. In other words, whether to carry out their ends, they must resort to entreaty or can prevail by force. Remember, prophets have been victorious, armed prophets have been victorious, and all unarmed prophets have been destroyed. So you need support from government. We need support from pharma companies. We need support from money. Apollo 13, they discovered the problem, so they found the solution. First of all, we have to discover that we have a problem, and the COVID-19 highlighted the presence of a problem. Before COVID-19, the problem was not really understood. In the short term, this is what happened to ambulatory visit in United States. Overall is the blue line, the absolute numbers. So you have a decrease of visits, a decrease of in-person visits. The green line is the televisit. Difference in Midwest, Northeast, South, but decrease of visit and increase of televisit, and now we have roughly a 20% of televisit. This is in percentage. 78 are in presence, but 21 are televisit. We started in Italy with the Telemedicine Subito project. We point out the differences between in-presence visit and televisit. We put the Skype symbol to explain. This was sent to doctor, to many relevant people in Italian national healthcare system. So we had the Regione Lazio as an example that started telemedicine services in the day 22 of July. So the army started the law for public and private is cheap, same amount of in-person, no extra cost. Those are lessons from, with free tools. And there is a law, you have to. You can't just say, yes, maybe, you have to. Then the manual. Please read the manual. What will be the next future from the lesson? Well, this is very interesting, the survivorship bias. They try to understand where the place where to enforce the airplane, and they use the bullet holes on the wings and on the tail, and they said we have to empower the wings and the tail. But a mathematician and statistics said no. Those holes are in the airplane that survived. We have to check the other areas, the engine, the pilot, because with holes in the pilot, in the engine, they were not back. And the error now is trying to enforce the emergency, trying to enforce the hospital in the emergency room. We have to enforce the other. You have to avoid the hospital. You have to avoid the intensive care. So the next future again. This is the digital health is a flagship initiative on WHO Europe. You explained I was, yes, a champion for this initiative, but we have to change the point of view. Those are glasses, but those are in metal, those are Murano glasses. Those are frail. You have to avoid that the frail fall, because, lesson from patient, doctor, do you know that we die because we fall? This is a lesson from a patient. You have to avoid the patient falling, it's not a problem of chronicity. So we started a project that is in Lazio region, a frailty project with Europe, with the National Research Council about AI. This is an example of the use of frailty index, same age, Mario Rossi and Gino Bianchi, but Mario Rossi with this frailty index has 28% of mortality risk in 3 years, Gino Bianchi only 8%. It's not a problem of chronicity, of frailty. So this is the future, AI, 6 fields, this is the project. We want to monitor environment. Why AI? Because we have sensor. We are integrating sensors, mobility, CO2, temperature, VOC, movement, lot of parameters integrated with AI, and a control panel for environment care, mobility, biometrics, rest quality. And we will have something like this, a dashboard, easy to read, automatic alarm. So what are the lessons for the future? From chronic to frail, we have people, not disease. You know, Dr. House, I am in love with disease. I would like to avoid patient. This is not good. We have person, not disease. And the person could be rich, could be poor, could be with a university degree or only without any kind of degree. AI is not instead, AI is together with doctors. Don't be afraid as doctor about AI, because the AI is here to work with us. From drug to drug and digital therapy together. We would like to enforce the adherence with digital treatment. Thank you. Here you can have my connection and everything. Thank you.
Thank you so much. I will kindly ask everybody a round of applause or the reactions if you like these presentations, so we can have a little bit of a digital human touch here on the booth. And I think that we are receiving here the applauses for your presentation. Thank you very much. Thank you for this sharing and good thought leadership.